Dengue fever, signs and treatment after floods and storms. Dengue fever is an infectious disease caused by the Aedes mosquito, common in tropical and subtropical regions, especially after floods and storms. The humid environment and stagnant water create ideal conditions for mosquitoes to breed, increasing the risk of dengue outbreaks. The disease can cause severe symptoms and even death if not detected and treated promptly. This article provides detailed information on the signs, prevention, and treatment of dengue fever after floods. 1. Signs and symptoms of dengue fever. Dengue fever typically progresses through 3 stages: febrile, critical, and recovery. Understanding the symptoms is the best way to detect and treat the disease early. A. Febrile stage. In the early stage, the patient will begin to show initial flu-like symptoms, including sudden high fever, fever reaching 39 to 40 degrees Celsius, lasting 2 to 7 days, severe headaches, pain in the forehead and temples, muscle and joint pain. Common symptoms include muscle and joint aches. Rash. Red or spotted rash appears on the body after the fever. Example: a person experiencing sudden high fever, headaches, and muscle pain may have early signs of dengue fever. They should visit a doctor for examination and early treatment. B. Critical stage. If not detected and treated in time, the patient may enter the critical stage with more severe signs: subcutaneous bleeding, red spots or bruising on the skin caused by bleeding, nosebleeds, gum bleeding, a sign of a significant drop in platelets, vomiting, abdominal pain. These are symptoms of digestive disturbances, often indicating internal organ damage. Example: a patient who develops bruising on the skin and gum bleeding after a few days of fever is showing signs of entering the critical stage and needs immediate hospitalization. C. Recovery stage. If treated correctly, the patient will gradually enter the recovery stage. Symptoms such as fever and pain will decrease, and the body will regain strength. Energy recovery. The patient begins to feel better, regains appetite, and their skin becomes rosy again. Platelet levels increase. Platelet and white blood cell levels in the blood gradually return to normal. 2. How to prevent dengue fever after floods. The environment after floods creates conditions for the Aedes mosquito to breed, so dengue prevention must be carried out carefully. A. Eliminate mosquitoes and remove stagnant water. Aedes mosquitoes breed in stagnant water, so eliminating areas with standing water is a crucial preventive measure. Cover water containers, cover water tanks and storage containers to prevent mosquitoes from laying eggs. Remove stagnant water. Eliminate or cover items that can collect rainwater, such as tires and flower pots. Example: a family can cover their water tanks and regularly check the garden to ensure there is no standing water after rain. B. Use mosquito nets and repellent. Preventing mosquito bites is a direct way to reduce the risk of dengue fever. Sleep under mosquito nets. Use mosquito nets, especially at night when mosquitoes are most active. Use mosquito repellent. Apply mosquito repellent when going outside, especially in the evening or when working in damp areas. Example: children going to school or playing outdoors should apply mosquito repellent and wear long-sleeved clothing to avoid mosquito bites. C. Spray insecticide. Spraying insecticide is an effective measure to reduce the number of mosquitoes in residential areas, especially after floods. Spray on a schedule. Conduct regular insecticide spraying in residential areas after floods to prevent mosquito breeding. Coordinate with local authorities. Participate in insecticide spraying programs organized by local health authorities. Example: a community after floods can work with health agencies to organize mosquito spraying in residential areas. 3. Treating dengue fever. There is no specific medication for dengue fever, so supportive care and symptomatic treatment are the only ways to help patients recover. A. Home treatment. For mild cases, patients can be treated at home under medical supervision. Fever reduction. Use paracetamol to reduce fever, avoiding aspirin or ibuprofen as they may cause bleeding. Rehydration. Drink plenty of water. Electrolyte solutions like Orasol or fruit juices to avoid dehydration. Example: A patient with mild dengue fever can rest at home, drink plenty of fluids, and closely monitor their health. If symptoms worsen, they should seek immediate medical attention. B. Hospital treatment. For severe cases, hospitalization is necessary for monitoring and treatment. Intravenous fluids. Administer IV fluids to maintain blood volume and prevent shock from dehydration. Close monitoring. Regularly check platelet levels and blood pressure to ensure the patient is not suffering from internal bleeding. Example: a patient showing signs of internal bleeding will be hospitalized and receive intensive care to prevent fatal complications. Conclusion: dengue fever is a dangerous disease, especially after floods and storms when mosquito populations increase. Early detection, proper prevention, and timely treatment are essential to protect the health of individuals and communities. Always keep the living environment clean, eliminate standing water, and use mosquito control measures to minimize the risk of infection.